Okay. My first time using Zoom, so please bear with me. All right, so it is being recorded, today's webinar, and the link to the recording is right here on this slide, where it will be available shortly after today's presentation. Again, we did the introductions, and we have a little bit of an agenda for you. Again, we'll have the Q&A part at the end of the presentation, having monthly updates, where we have another meeting scheduled, and then the COVID updates with the services. And then we'll have some testing reporting requirements by CMS, the vaccine partnership update, the EOC, KDEM, Sedgwick County Health Department, Stop-Gap program, and the N95 decontamination program. And I think we have Cody Charvet on our line. He's from the Sedgwick County Emergency Operations Center, and perhaps he'd like to present this part of the presentation since he's with us today. And then we'll talk about the emergency public health order, which talks about the phase 2 for Sedgwick County and the metrics. And then we'll talk about the CMS and KDADS visitation with compassionate care indoor, outdoor, and window visitations. And lastly, the Q&A with the presenter. And we have a slide with resources. And again, if you have any questions or anything, comments along the way, please put them in the chat box and we'll try to address them as we go along. Let me see. There's that slide right here that says the same thing. And going on to our monthly meetings, we're going to have our next meeting. We've already got it scheduled and on our calendars here at the Health Department. And it'll be for December 8th. At the same time of today's meeting, 11 to noon, which seems to be available for everyone on the calendar here at the Health Department. If anyone in our community is unable to join at that time, you can always view the slides and the recording on the Sedgwick County website. And now to give the COVID-19 update, we'll have Kaylee Harvey, and I'm going to turn the controls over to Kaylee. Thank you all. Here you go.
Good morning, everybody. I hope everybody is doing well this morning. So I'm going to talk through the COVID-19 update. As of kind of yesterday and this morning, there are 9,297,353 cases so far in the United States. We have 89,227 cases in Kansas and 12,671 cases in Sedgwick County. We have 133 deaths in the county so far. And we've had 40 total adult care home clusters, and we currently have 416 active cases in those clusters. So I'm going to go into testing, and I believe Ned's going to talk about this first slide.
Right, she should be able to.
Okay, all right. So there are, CMS does require skilled nursing facilities to test staff and residents. And on October 27th, KDADS issued guidance that requires the nursing facilities to begin using the 2-week county positivity rate, which is published by the Kansas Department of Health and Environment. And this is the website that you can find that. That is the positivity rate you need to be using to determine how often you need to be testing your staff. And that positivity rate by county is found by clicking the box labeled the nursing home metrics. So it revised the guidance and changed it to the nursing home metrics that they now have listed at that website. Okay.
And then, oh, go ahead.
Go ahead. You can take it.
Alrighty, so this comes straight from that website that Annette talked about. So if you go to the nursing home metrics, KDT has this at a positivity rate of 16.8%. And so that's red. They'll have an entire map, but you can select just Sedgwick County to get information about our county specifically. And this is for the rolling 14-day period of October 18th to October 31st. And so, Annette, do you want to take this one?
Yes, sorry. So there is the CMS does have the final rule on nursing facility testing, and that is CMS 3401-IFC. So that's the policy and regulatory revisions in response to the COVID-19 public health emergency related to testing requirements and the COVID-19 focus survey tool. And this is where you can find that information that is published by CMS related to that testing requirements from CMS for nursing facilities. So the guidance for the point of care testing, and I'm sorry that I wasn't able to be on site, but here is the information and the site on the CDC for the point of care testing. And I don't know, Haley, if you wanted to add to that regarding that requirements for point of care testing.
I don't think I really have anything to add.
Clarify CDC.
Okay, so you just go to that site and it'll tell you the regulatory requirements and who is authorized to do those point of care testing.
And then, so Sedgwick County Health Department can provide nasopharyngeal or NP swab and/or saliva testing kits to providers or to facilities per CMS guidelines. And so, if you do need some of that supplies, you can reach out to the health department. KDHE has also opened their new reporting portal for those mandated facilities via the VENX rapid test. And so you can go to that link, that diseasereporting.kdhe.ks.gov, and sign up to use their portal. And so any testing results should be reported to KDHE through that portal, not to Sedgwick County. They should go to KDHE. If the facility is a CMS-funded facility and you do have a test that is positive with the antigen testing from that rapid test, then you must test that individual via the NP swab within 48 hours to confirm that testing. And again, you can work with the health department if you need to for those supplies. So now we're going to talk about nasopharyngeal or NP testing for adult care home. Adult care home staff can still be tested weekly through the health department by calling the United Way of the Plains at 211 for an appointment through a drive-through. If a staff or a resident does test positive, then other staff and residents in your facility should be tested per Sedgwick County Health Department or KDHE recommendations, depending on who you reach out to. And test results for the health department are taking about 4 to 6 business days right now. They may be less than that, but that's kind of the average we're seeing. And then if you are not aware, we did go ahead and open up to all asymptomatic testing through the health department. And so anyone at this time in the county can be tested. So for the saliva testing, if facilities are interested in doing saliva testing via the Clinical Reference Laboratory or CRL, then the first thing you need to do is register at this link. And that will go to the health department, and then somebody will reach out to you with more information about that saliva testing. And then, so the CMS requirements for a nursing home. As stated before, all testing results are required to be reported, and they are required to be reported to KDHE via their disease reporting portal. And that's point of care and any specimens that you send out. Now, you're welcome again to give the health department, the Sedgwick County Health Department, a call to let us know about those results, but you must report them to KDHE. And then KDHE reports to CMS are being sent on behalf of the nursing home. And so the local health department does get those results back from KDHE if you report straight to them. And so if you do have questions kind of about that reporting portal or how KDHE is reporting to CMS, you can reach out to KDHE at their EPI hotline email, which is kdhe.epihotline@ks.gov. So we are going to talk just briefly about the COVID-19 vaccine and pharmacy partnership. So if you are interested in participating in a pharmacy partnership, the long-term care facility should have signed up or opted out starting October 19th, and there is a registration portal that is open through November 6th. Skilled nursing facilities will make their selection through the National Healthcare Safety Network, or the NHSN, at the website on the slide, and an alert will be incorporated into the NHSN long-term care facility COVID-19 module to guide users to the form. I apologize for a lot of acronyms. Adult care homes will make their selection via an online RedCap link at the link on the slide and use that sign-up form. And then Susan has listed some links for you for additional information. We've got the pharmacy partnership for long-term care program for COVID vaccination through KDADS. We also have the pharmacy partnership for long-term care programs for COVID-19 vaccine FAQ from KDADS. And if you do have any questions about the pharmacy partnership for long-term care program, then you should contact the EOC event 494 at cdc.gov. So Sedgwick County Health Department will be contacting facilities to determine those facilities that signed up to participate in the COVID-19 vaccine pharmacy partnership. And that should begin happening in the next few weeks. And we do appreciate your response and cooperation in assisting us with our collecting and planning efforts as we start to try to plan for when we do start seeing the COVID-19 vaccine in the county. And so now we're moving to requesting and ordering PPE and the N95 respirator decontamination process. And Cody, I don't know if you're on the line to speak to this.
Yes, I am. Can you hear me?
Yes, we can. Thank you.
All right. Thank you. All right. Well, this is going to be mainly a review of, if you were on last month's call, nothing has really changed. If you weren't, then we can get you caught up. But the big news that came out last month right before this call was the information about the stopgap business PPE program through the state of Kansas. So any facilities licensed by KDADS can request this PPE through KDEM's stopgap program. And you see you saw on the previous slide the facilities that were listed. The stopgap program website is on your screen now, and I also just posted it into chat so you can copy and paste it from there. The big thing to understand, if you're going to order supplies, testing supplies and PPE through KDEM, you must require what we're terming a proof of denial, an unsuccessful attempt to order this through your normal vendor process, something that indicates it's back ordered, something that indicates we're not able to provide to you because you weren't our customer before COVID. Whatever the reason might be, you will need to attach that documentation to prove to them that you tried to get it through normal vendors but were unsuccessful. If you don't provide that, they are not going to fill your order. So as we move on to the next slide, the other information that is really important to remember on this is that there is an exception for life safety. For example, if your facility suddenly is dealing with an outbreak of COVID patients among your staff or among your residents, and you don't have the supplies on hand to protect everybody properly, we can get that information from you, we can get those supplies for you through requesting KDEM through the Sedgwick County EOC. So you would send an email to logistics@sedgwick.gov, and we would get you hooked up. There's a form to fill out. We would forward it to the state, and hopefully the state will look at it and decide, yes, it does meet their criteria, and they will be able to get you the supplies on an emergency basis. The items that we're talking about through this, either the emergency or the stopgap program, are masks and face shields, gowns and coveralls, and other PPE related requirements such as gloves, although gloves are hard to come by these days. Now, it's important to recall that if you are a first responder or government agency, everything I just talked about does not apply to you. First responders, government agencies, you still order as you normally would through the Sedgwick County EOC. So get a hold of us at that email that you see there on the screen, logistics@sedgwick.gov, and we will get that gets you hooked up for that. If you're new to the process, we have a great team on our logistics staff that will walk you through the form that you need to fill out and the other things that we require for this, but it's a fairly painless process. The big thing that folks request from us are N95 masks, among other items. Of course, gloves and gowns are high on the list as well. But Specifically, when we talk N95 masks, there are some additional requirements that we impose. First of all, we would like everybody to get fit tested on N95s. They do you no good if they are not properly fitted to your staff. So there are resources available for fit testing, both through the government and through private entities. But beyond that, once you've got them tested, once you've got a supply of masks, it's also very important that we make our supply of masks last as long as possible. And to help facilitate that, the National FEMA Emergency Management Agency has set up a nationwide contract with the Battelle Corporation to provide for decontamination of N95 masks. We've been doing this since June, I think, is when it first started up. And so it shouldn't be new to anybody. But if it is, again, contact us at Logistics and we'll get you set up. A couple months ago, actually at the end of September, I guess it was, the state of Kansas had a Battelle site, decontamination site in Topeka. That one closed, and there was some confusion at first about what that was going to mean for folks in Kansas who use the Battelle system, but it had zero effect. Basically, the only difference was the free shipping labels that we print off now ship your product to Oklahoma instead of going to Topeka. Otherwise, nothing else changed. It's still available at no cost to the participants through the end of the year at least, and it could potentially be extended beyond that. Some things to remember about your N95s, and this may need to be a policy for folks that have the staff that use N95s. If they get soiled with makeup, they are not going to be clean. They are not going to be decontaminable. How about that? They will not be able to be decontaminated. That's the way I want to say that. And you see the other things that could soil those, that they just can't get those things out. So if we send masks to Battelle and they can't decontaminate them, they will throw those out. And so you will have to find some other way to replace those. So please just make sure your staff is aware that they need to keep those masks as clean as possible, and then they can be sent off to Battelle to be decontaminated for the COVID that they might be exposed to. So that's the long and short of it. Did anybody have any questions for the logistics piece or the PPE piece before we move on? All right, I'll turn it back over to you folks.
Thank you, Cody. So now I'm going to walk in through the emergency public health order. So the emergency public health order from the Sedgwick County local health officer had changed on October 22nd, 2020, and is now effective through December 9th of 2020. And again, it's not voluntary for masks. It is a requirement to comply. The order was revised on October 22nd to further reduce the spread of COVID-19. Some points in the order include that residents are still required to wear face coverings or masks in public spaces, both inside and outside. The definition of a mask or other face covering does not include a covering that is equipped with a one-way valve or vent through which air can be exhaled. And additional exemptions are included in the public health order. The order still allows for groups of 15 or fewer individuals. However, those individuals should generally maintain a 6-foot distance from one another. Where individuals are in one place and unable to maintain social distancing, the individuals may gather in closer proximity in groups of not more than 15 people. So basically you can have kind of 15 people together and they have to know each other. And then you can have 6-foot distance and have another group of 15 people kind of grouped together. But again, they are still required to wear a mask within public gatherings. For facilities, the order limit does not limit visitation to a cap of 15 people. But again, groups of 15 or fewer individuals must be located at least 6 feet in all directions from other groups of 15 or fewer individuals. So as I stated before, you can have to have a bubble of 6 feet in all directions around each group. The order still adopts phase 2. And the determination of the phase considers the Sedgwick County positivity rate and other metrics. And you can read that complete order at the link that is shown on the slide. So as stated, Sedgwick County is in phase 2. So our metrics right now, and these are hot off the press, we are looking at a 19.2% positivity rate. I do want to throw out the caveat that our testing is a little bit lower, and these are still kind of variable numbers. We do these metrics on Monday evenings and then on Friday mornings. And so it's likely this will change some before Friday, but I don't know how much it will go down. Overall, our cases are increasing, and they have been for the past few weeks. So again, the metrics are updated kind of a bi-weekly basis, and you can find them on the Sedgwick County website. If you go to the main Sedgwick County page and click on COVID metrics, or this link right here will take you directly to them. And now I'm going to turn it over to Annette for updates on visitation.
Okay. Next slide. So we'll talk about visitation and what's going on. KDADS had previously instructed facilities to use the KDHE school gating metrics and guidance on 9/23. As we stated earlier, they have amended those instructions to reflect that facilities, that would be all nursing facilities and facilities licensed as adult care homes, should use a 2-week county positivity rate published by KDHE. And again, here is the link that you can go to at Kansas Department of Health and Environment of Kansas to see what those positivity rates. So as Kaylee just showed you the county positivity rates, that's not what you use. You use the ones that's published by KDHE. So KDADS has advised adult care homes to utilize this data when making facility reopening and visitation plans. So you should have already major reopening and visitation plans, but your implementation of those plans will be based on the data at the KDHE website that has the positivity rate published by them. Next slide. So for the guidance for long-term care settings, all guidelines for long-term care settings, including nursing facilities, assisted living, board care homes, homes plus, residential health care facilities, the types of visitations that are identified are the compassionate care, indoor, outdoor, and window visitation. And here is a website from KDADS about a document that they had published and put out recently on visitation guidelines, what to expect now, which is a really good document. Next slide, and here that is. So that really is for consumers, family members, and others to help them understand the visitation guidelines and requirements. So this is a guide for residents, as I said, for family members, for visitors, and also for residents, so that they can know and understand about what to expect when visiting and how that will look. So the visitation is according to the facilities, the environment, and the residents' need, in addition to the positivity rate as published by KDHE. They follow strict protocols on reducing risk COVID-19 transmission. So all of these requirements and guidelines really focus on how to prevent the spread and really have those very strict guidelines and protocols to ensure safety. Okay, next page. So the visitation incorporates a person-centered approach. So in the guidelines that KDADS published, it really is looking at a very person-centered approach and adheres to the core principles of COVID-19 infection prevention. But it really also directs facilities to really look at each person and identify what their needs are and what their situation is when you're doing a visitation plan. So, of course, the outdoor and window visitations pose lower risk of transmission due to increased space and airflow. The indoor visitation occurs in facilities where there are low to medium county positivity rates and includes visits beyond compassionate care. But again, that indoor visitation is really very dependent on where each county is as far as their positivity rate. Okay, next slide. So outdoor visitations are allowed with all precautions, and these include screening the visitors for symptoms of COVID-19. Residents and visitors must wear a cloth face covering or face mask for the duration of the visit. You have to require the practicing of social distancing and performing hand hygiene. So using the alcohol-based hand rub upon the visitation. So those are requirements, and outdoor visitations can occur during even the high rates. Okay, next for the outdoor. For outdoor window visits, they are to be conducted in a manner to reduce COVID-19 transmission and providing sufficient space. So as the last slide indicated, making sure that you have that social distance, the PPE, and the social distancing, and all of that's in place. And that everybody knows the rules. So when visitors come to do these visits, they need to be very informed of what those requirements are and are sure to follow those. Okay, next. So during any phase, you're allowed to do the indoor compassionate care visits. The facilities will determine when compassionate care visits are appropriate. And according to CMS guidelines, these compassionate care visits includes, but are not limited to, when the resident is in hospital care, when the resident's illness or disease is worsening or life-threatening, when the resident is exhibiting significant decline physically or mentally due to the social isolation and lack of visitation, when the resident is withdrawing, no longer eating, showing signs of significant depression as a result of loss of contact with family members. Again, this includes but is not limited to. So there are other situations you as a facility need to determine that when those things are, but it is not limited to this. And so the goal is to identify what those compassionate care regulations or definitions will put for each facility. Okay, next slide. For CMS, when county positive rates exceed 10%, indoor visitations are not allowed except for the compassionate care visits. So that's why it's really important to go to that website and look and see where the positivity rate is for the county you're located in. Okay, next slide. Another important criteria for the visitation guidance is when you do allow visits, you need to make sure that visitors with subsequent illness within 7 days of the visit should report their illness to the nursing facility and or the adult care home and to the Sedgwick County Health Department. Next slide. And here are some resources that you should review. The CMS guidance that mandates nursing facilities include nursing homes to provide for visitation based on the county positivity rate. That is from September 17th of 2020, and there is the link for that. And then the KDADS visitation guidance for the long-term care setting that would be specific to assisted living, board care homes, home plus nursing facility, which mirrors in some respects the CMS guidance for nursing facilities and skilled nursing facilities. And there is the KDADS website for that. Okay, next.
So this is just some.
Go ahead.
Go ahead. This is just some additional resources that are available to you if you need. And then past webinars, again, can be viewed at the Sedgwick County COVID-19 resource webpage, and the link is included. And if you have follow-up questions or comments, you can email Susan Lee, who coordinated this webinar and sent out the email to all of you. And her email is on the slide. And so that concludes today's presentation. And so if you have questions, now is the time to ask them. And then just as an FYI, our next webinar will be on December 8th, again on same time. So at this time, if you have questions, you can put them into the chat and we will make sure we get those answered. So there's a question, is there any information on where Home Pluses can purchase rapid test kits for their community? Cody, do you by chance know anything about where they can get test kits? Cody, if you're talking, we can't hear you.
You're right. I have to press 3 buttons to get to be able to talk, and only press 2. Can you hear me now?
Yeah, thank you.
Okay, sorry about that. In general, the answer to that question is no. I don't know who has kits available just to purchase. The caveat to that is that if they are on an approved list by KDADS, if they are a federally funded facility, then there's a list, I believe it's 21 agencies, or 21 businesses, I should say, 21 care home facilities in our county that can order those supplies, those testing supplies through KHEL. In order to do that, they get a hold of us here in the Sedgwick County EOC, so at the logistics@sedgwick.gov email address. But if they're not on that list, KDM won't be able to help them.
We can look some information up, and Susan can include it in the email she sends out with the slides and everything to figure out where you may be able to get some of those. So the next question is, do all adult care homes need to test staff even if 85% of our residents have been tested and are negative, and we screen every shift on staff and residents? If you are funded by CMS, then you must follow their CMS testing guidelines. And so that would require you then to test staff per those guidelines. If you are not, then we would recommend that your staff can again contact the health department if they want tested weekly. If you don't have a positive yet in your facility, you could continue with the screening protocols. But if a positive does come up at that point, then you would be required to test everyone. But again, if you are funded by CMS, you must follow the CMS testing guidelines.
Kaylee, if you don't mind, I'll jump back in.
Yep.
I had mentioned that list of 21 different businesses. I pulled the list off because we had it printed off. Saying 21 is a bit deceptive because the first 10 on the list are all Grace Med clinics, and then Health Corps, Hunter Health Clinics, there's 3 of those listed, 3 Guadalupe clinics listed, the Mayflower Clinic, and then of course the Sedgwick County Health Department. So that's really the only ones that are on that list that I mentioned that can order them through the state. So everyone else will have to go through private vendors. Hope that helps.
Are there other questions anyone has?
If there are no other questions, everybody has my email information to contact me with any follow-up questions that I can pass on to Kaylee or Annette to get them answered. And so I'll like to leave it at that if there are no further questions for the presenters at this time. My email address is susan.lee@sedgwick.gov. And Kaylee, could you put that in the chat box too, please?
Yes, I can.
And then that way, if you think of anything after we end today, please do email me your question. I'll make sure to get it answered for you. And just to follow up, the slides and the recording should be available on the website by the end of this week, just so everybody can get them there, and any information you wanted to record, you'll just be able to copy it off the slides at that time, so you won't have to take a lot of notes or anything. And I will send the email out with the slides in a PDF form with the link, so you'll get that by the end of this week. It should be doable that it gets done, because everything that was presented was covered as far as any little changes along the way with some questions, which have been addressed, and the slides will be updated accordingly to that, so that they're complete and accurate. I'd like to thank our special presenter, Cody, for jumping in there when I really didn't clue him in on that, but he was very informative, even if it was a review. Thank you very much, Cody, for doing that. We appreciate it. And right now, I appreciate everybody who signed in and had a chance to view this morning's presentation and hear the information from our presenters, Annette and Kaylee. And thank you all very much, and have a great day and stay safe. Bye-bye now. We need to save the chat. Pardon? Okay.